I'm here to discuss regarding ligament injuries around the knee especially. See, around the knee are the ACL injuries and the meniscal injuries. The main causes for a ligament injury around the knee is mainly sports injuries. Abroad it is mostly sports injuries. What we see in our day-to-day life is mostly two-wheeler accidents, road traffic accidents, slipping on the floors, slipping through the stairs. Depending on how bad or good the injuries are, the treatment can be according to that. Hello, I am Dr. Hitesh Kubadia, orthopedic and a joint replacement surgeon at Apollo Spectra Hospitals, Mumbai. I am here to discuss regarding ligament injuries around the knee especially. The most common ligament injuries which we see around the knee are the ACL injuries and the meniscal injuries. These are the two very common injuries, and this requires very often some form of treatment. Knee injuries are very common because knee, if you understand the knee structure is actually stabilized by a lot of ligaments around it, and also there are shock absorbers in the knee so that it does not get loaded too much and everything. So these ligaments all work in tandem with each other. So even if one gets disrupted, the whole knee starts shaking up, and you can feel that unsteady gait, you can feel that give way feeling around the knee, you can feel that instability around the knee. Hence, treating these ligament injuries becomes very, very important. The main causes for a ligament injury around the knee is mainly sports injuries. Abroad it is mostly sports injuries. What we see in our day-to-day life is mostly two-wheeler accidents, road traffic accidents, slipping on the floors, slipping through the stairs, especially in people who have very weak knees, who don't have good stability around the knees. They are more prone to get their knees injured, compared to a person who's got reasonably stronger knees or stronger hips. As far as the ligament injuries around the knee are concerned, the main thing about the ligament injuries is we need to grade them first. Depending on how bad or good the injuries are, the treatment can be according to that. If there are very basic injuries, they are very strenuous injuries, very often good physiotherapy can help them out, and they can do very well with good exercise program. But if the grade of the injury is much ahead, then very often we need to treat them surgically. Nowadays, all these injuries around the knee are done arthroscopically, that is minimally invasive keyhole surgery is what we do. And we can repair those meniscuses. The meniscus is basically a shock absorber in the knee. We in a younger patient, we tend to repair them. Earlier we used to actually knock them off, we used to take them off, we used to trim them off. But nowadays, in very specific knee injuries, we try and retain as much of a shock absorber for the knee. ACL injuries, we need ACL reconstructions. So there are a lot of newer things which are coming up with these ligament injuries in trying to reconstruct the knee to as near normal as possible as it was before. Yes, post surgeries, these knees do require a reasonable amount of a rehab time, but that with any ligament injuries, it is expected to be done so. But in today's modern day and age, and with the expertise which we have and the systems which we have at Apollo Spectra Hospitals, this is done very, very easily. Thank you.